for my STD project, I chose the Acquired Immunodeficiency Syndrome, also known as AIDS. What is AIDS? AIDS stands for Acquired Immunodeficiency Syndrome and is defined as an infection caused by the human immunodeficiency virus, or HIV. It interferes with the immune system, decreasing the body's ability to fight infection. It is the most severe phase of the HIV infection. Organs affected. AIDS is an illness that affects the body's immune system. Due to this fact, the disease can have many negative effects throughout the body. Specifically, an individual who is infected by AIDS will have a CD4 cell count below 200 cells per cubic milliliter of blood. They become vulnerable to opportunistic infections that can be harmful in many different ways. Disease prevalence and who is affected. In the United States, it's estimated that 1.2 million people who are over the age of 13 had HIV, the virus that causes AIDS. 69% of the cases were among gay or bisexual men, 24% were among heterosexuals, and 9% was among those who inject drugs. The 25 to 34-year-old age range has the highest amount of new diagnoses every year. How do you get infected? The primary way an individual can become infected with the disease is by having sexual contact with an infected partner. Another way it can be transmitted is through sharing needles, syringes, or other drug injecting equipment. The blood of an infected individual can carry the HIV virus. It's possible for a mother to transmit the HIV virus or the HIV to her children. However, it is less common due to the advances in HIV prevention and treatment. Signs and symptoms. When someone is first infected with HIV, their symptoms may include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. As HIV advances to stage 3, also known as AIDS, these symptoms may become more obvious. However, when you first get HIV, it's also important to note that sometimes you won't notice any of these symptoms. So if you think you may be at risk, try to get a test. So disease, diagnosis, and treatment. Medical professionals will look at your signs and symptoms, but the only way to know if a patient is infected is by administering a test. There are a variety of tests available. Some use blood samples, while others can use oral fluid. Those who are pregnant are more at risk should seek out a test. While there's no way to cure HIV or AIDS, it's possible to treat them. Antiretroviral medication is used for those infected with HIV to help lower the viral load and raise your CD4 cell count. Prevention. The best way to prevent getting AIDS is by not getting HIV. Avoid sexual activities that could transfer bodily fluids that contain the virus. If mother has HIV, if she takes medication before birth, and the baby takes medication 4 to 6 weeks after being born, the chance of HIV spreading to the child is less than 1%. If you inject drugs, avoid using a used syringe. If you already have HIV, take antiretroviral medication to avoid the progression to AIDS. And these are my sources: Johns Hopkins Medicine, Medical News Today, and Centers for Disease Control and Prevention. Thank you.